Hi, my name is Andrea Furlong, or you can call me Annie. I work with Dr. Jonathan Mason here at Tidewater Orthopaedics. We both work in spine surgery. I have been a PA since 2012 and have been working with Dr. Mason and at Tidewater Orthopaedics since 2017. I'm going to talk to you about the discs. You have discs throughout the entire spine, in the cervical region, which is in the neck, in the thoracic region, which is your mid-back, and in the lumbar region, which is your lower back. The discs are made out of cartilage. These discs act as a cushion in between the bones or a shock absorber. You do have to remember that gravity is always pushing down on these discs, so eventually your disc will start to narrow, or we call that degenerative disc disease. A herniated disc is different though. A herniated disc is caused by a disc bulging or protruding, or when the disc tears and actually pushes the pieces of itself towards the nerve or the spinal cord. A herniated disc can be caused by a number of things. One, it can be genetic. Sometimes if your mom and dad had injuries or problems with their discs, sometimes that predisposes you to being at risk for a disc injury. Two, it can be from trauma, such as a fall or a car accident. And three, it can be a repetitive type of injury, such as from heavy lifting, bending, twisting. Usually the signs and symptoms of a herniated disc, it will cause neck pain or back pain depending on where the disc is located. It will eventually cause nerve pain, which can travel into the arms, which that would happen if the disc herniation was in your neck, or into your legs, and that would happen if the disc herniation was in the lumbar spine. Usually a disc herniation is diagnosed through clinical signs and symptoms and through our physical exam. So when we see you, we take down your history and we do a physical exam, and we can alert you and let you know if that's happening. The other ways to diagnose it are through imaging with X-ray, CT, or MRI. If a disc herniation is mild, typically the body can heal this, but it may need some extra help with physical therapy or medication. And every once in a while, an injection of cortisone or a steroid that is similar to cortisone, that's just an anti-inflammatory. If a disc is more moderate to severe in size, or if you're getting more weakness or more severe constant pain that's moving into your arm or your leg, and your weakness is getting worse over time, then we would talk to you about more aggressive treatment, such as the injection versus surgery. Now, surgery is typically a last resort. We always want to try to get you better with the most conservative, whether that's physical therapy, medications, or the injection, or all the above. Surgery, involves its own risks as far as with anesthesia. Now, the only time surgery we do indicate for this problem without doing the physical therapy or the injection is if your imaging, such as the MRI or the CT scan, shows us that there's a chance for any severe nerve damage or paralysis. The type of surgery for a disc herniation is called a discectomy. Discectomy means that we're literally taking a piece of that disc out. We're not taking the entire disc out. This is done through a minimal invasive procedure where we go in through a small incision, and it is considered outpatient. You go home the same day. Now, your nerve pain should go away or be dramatically reduced as soon as you wake up from surgery. You will, of course, have back pain from the incision, but that will be controllable with medicines, which you will not need for very long. Staying active is very important for the spine and for a disc herniation. If you are not active, you will become stiff, which can then lead to more soreness and pain. So staying active is important. Now, physical therapy is very helpful because it provides stretches and exercises that will prevent any further injury, but it will also just help extend your flexibility and extend your range of motion. Now, physical therapy for the disc herniation, they're going to talk to you about deep lumbar stretches. They're also going to talk to you about traction, where they gently stretch the spine, and that takes pressure off the disc and allows a disc herniation to be, so to speak, pulled back into its place. Physical therapy after surgery is important, but it's not always indicated. It depends on the person, it depends on the problem, and the type of surgery that they had. Thank you so much for giving me your time today and watching this video. And please don't hesitate to look at our other videos on our websites.